Introduction to ultrasonic fat cavitation. Ultrasonic fat cavitation is a cutting-edge, non-invasive cosmetic procedure that has gained popularity for body contouring, cellulite reduction, and localized fat reduction. This revolutionary treatment offers a safe and effective alternative to more invasive procedures like liposuction. It relies on the power of ultrasound waves to target and break down adipose tissue in specific areas of the body. The procedure is designed to be gentle yet effective, providing noticeable results without surgical intervention. Mechanism of ultrasonic fat cavitation. At its core, ultrasonic fat cavitation leverages the science of ultrasound technology, which involves sound waves with frequencies beyond human hearing, typically above 20,000 Hz. These high-frequency ultrasound waves are precisely directed into the subcutaneous fat layer, which is the layer of fat located just beneath the skin. This targeted application ensures that the energy is concentrated on the fat cells without affecting surrounding tissues. The precision of this technology is what makes the treatment both effective and safe for clients seeking localized fat reduction. Cavitation process and fat elimination. The key principle behind this procedure is the creation of tiny gas-filled bubbles within the fat cells. When these cells are subjected to the ultrasound energy, these bubbles rapidly expand and contract, causing localized pressure changes. Eventually, these fat cells become unstable and rupture, releasing their contents, primarily triglycerides, into the interstitial fluid. The released fat is then metabolized by the body's natural processes, transported to the liver, and eliminated. This natural elimination process makes ultrasonic fat cavitation a safe and well-tolerated treatment. The body effectively processes and removes these broken-down fat cells, ensuring no long-term accumulation of released fat. Benefits of ultrasonic fat cavitation. Understanding the potential benefits of ultrasonic fat cavitation is essential for both practitioners and clients. This knowledge helps manage expectations and select appropriate candidates for the procedure, ensuring client satisfaction. The treatment offers a range of advantages, from aesthetic improvements to enhanced self-confidence. It's important to communicate these benefits clearly and realistically to clients during the consultation process. Targeted fat reduction. The primary goal of ultrasonic fat cavitation is targeted fat reduction in specific areas of the body. Clients typically seek this treatment to address stubborn fat deposits that are resistant to diet and exercise, such as those on the abdomen, thighs, buttocks, and love handles. The procedure can lead to noticeable inch loss and improved body contours, with studies showing an average reduction of 1 to 4 centimeters in circumference after a few sessions. It's crucial to explain that the degree of fat reduction varies based on factors like the number of sessions, individual metabolism, and adherence to post-treatment guidelines. Improved body contouring. Ultrasonic fat cavitation not only reduces fat, but also effectively sculpts and shapes the body. By selectively targeting fat cells, it allows for precise contouring, enhancing the body's natural lines. This means clients can achieve a more toned and sculpted appearance, significantly enhancing their overall body shape. For example, many clients report a more defined waistline or smoother hip-to-thigh transition after treatment. Cellulite reduction. Cellulite, often characterized by dimpled skin on the thighs and buttocks, is a common concern for many individuals, affecting up to 90% of women at some point in their lives. Ultrasonic fat cavitation can significantly help reduce its appearance. By breaking down the fat deposits responsible for cellulite formation, the procedure leads to a smoother, more even skin texture. This improvement in skin texture contributes to a more aesthetically pleasing and uniform appearance. Non-invasive and low risk. One of the most significant advantages of ultrasonic fat cavitation is its non-invasive nature. Unlike surgical procedures such as liposuction, it doesn't involve incisions, anesthesia, or significant downtime, making it a highly appealing option for many. This results in minimal discomfort, and a substantially lower risk of complications compared to surgical alternatives. Clients can typically resume their daily activities immediately, which is a major benefit for those with busy schedules. Quick, convenient, and gradual results. Ultrasonic fat cavitation sessions are relatively quick and convenient, typically lasting between 30 minutes to an hour, making it an ideal option for clients with busy lifestyles. There is usually no need for extended recovery periods, allowing clients to return to their daily activities immediately. Clients should understand that the results are gradual, not immediate. While some individuals may notice changes after a single session, a series of treatments, often 6 to 12 sessions, is recommended for optimal and lasting results. Setting realistic expectations is key. Non-restrictive lifestyle and self-esteem. Unlike certain surgical procedures that require significant dietary restrictions or lifestyle changes, ultrasonic fat cavitation allows clients to maintain their regular routines. However, a balanced diet and regular exercise can significantly enhance and prolong the results, maximizing the treatment's effectiveness. One of the less tangible but equally valuable benefits is the potential boost in self-esteem and confidence. Clients often report feeling more comfortable and self-assured in their bodies after seeing positive changes in their appearance, leading to improved overall well-being. Chapter 1 Conclusion. Practitioner Role. In summary, ultrasonic fat cavitation is an innovative and non-invasive cosmetic procedure offering several benefits, including localized fat reduction, improved body contour, cellulite reduction, and minimal risk. It represents the significant advancement in aesthetic treatments. As a practitioner, it's crucial to understand the underlying principles of the procedure and its potential outcomes. This knowledge enables you to provide clients with realistic expectations and safe, effective treatments, building trust and credibility. Emphasizing proper aftercare and lifestyle choices helps clients achieve and maintain desired results over time. This training manual will further guide you on performing treatments safely, adhering to hygiene protocols, and fulfilling legal obligations for a successful client experience. Importance of skin assessment. The skin, as the body's largest organ, plays a crucial role in a person's overall health and well-being. Its condition directly impacts the safety and effectiveness of ultrasonic fat cavitation treatments. When performing these treatments, it is paramount to recognize and understand various skin diseases and disorders. This knowledge is essential to ensure the safety and effectiveness of the procedure and to provide appropriate guidance to clients. As a practitioner, you will delve into dermatology, exploring common skin conditions that may be encountered. This expertise allows for informed decisions regarding treatment suitability and client care. Common skin conditions. Acne and eczema. Acne is a common skin condition affecting individuals of all ages, characterized by pimples, blackheads, whiteheads, and often red, inflamed areas. It affects approximately 85% of young adults aged 12 to 24. Clients with active acne should not undergo ultrasonic fat cavitation on affected areas, as the procedure may exacerbate their condition, potentially leading to infection or scarring. Treatment should be considered only after the acne has significantly improved. Eczema, also known as dermatitis, is a chronic skin condition resulting in red, itchy, and inflamed patches that can ooze and develop crusts. It affects about 10 to 20% of children and 3% of adults worldwide. Common skin conditions. Psoriasis and rosacea. Psoriasis is an autoimmune skin disorder characterized by the rapid proliferation of skin cells, leading to thick, red, scaly patches. It affects about 2 to 3% of the global population, with varying severity. Ultrasonic fat cavitation should not be performed on areas with active psoriasis, as it can irritate the skin and potentially trigger a flare-up. Clients with psoriasis should always consult with a dermatologist for proper management before considering this treatment. Rosacea is a chronic skin condition primarily affecting the face, causing redness, visible blood vessels, and sometimes pimples and pustules. It often appears in adults between 30 and 50 years old. Skin infections and lesions. Active skin infections, including bacterial, fungal, or viral infections, are absolute contraindications for ultrasonic fat cavitation. Performing the procedure on infected skin can spread the infection and lead to more serious complications, posing a significant health risk. It is imperative to ensure that clients are completely free of any active infections before proceeding with treatment. This includes common conditions like herpes simplex or impetigo, which can be easily exacerbated. Clients with unusual or suspicious skin lesions should be referred to a dermatologist for evaluation before undergoing ultrasonic fat cavitation. Skin lesions can sometimes be a sign of skin cancer or other serious conditions, making early identification crucial for client health and safety. Sunburn and general contraindications. Performing ultrasonic fat cavitation on sunburned skin can be painful and lead to complications such as increased sensitivity and potential blistering. Sunburns are essentially first-degree burns, making the skin highly vulnerable. Advise clients to wait until their sunburn has healed completely before scheduling a treatment session. Emphasize the importance of sun protection to prevent future sunburns, recommending broad-spectrum SPF 30+ sunscreen. In addition to specific skin conditions, there are other general contraindications related to skin health and safety that must be considered. These broader factors ensure the overall well-being of the client. Other contraindications: pregnancy and surgery. Pregnant individuals should strictly avoid ultrasonic fat cavitation, particularly in the abdominal area. While there is limited evidence of direct harm to the fetus, it is always advisable to err on the side of caution during pregnancy, due to potential unknown risks. This precautionary measure extends to breastfeeding mothers as well, as the effects of ultrasound energy on breast milk or the infant are not fully understood. Client safety and well-being are paramount. Clients who have undergone recent surgery or have open wounds should not undergo ultrasonic fat cavitation in the affected areas. The procedure may interfere with the natural healing process and significantly increase the risk of infection, potentially leading to complications. Other contraindications: allergies and medications. It is crucial to inquire about any allergies or sensitivities your clients may have to skincare products or topical anesthesia used during the procedure. Allergic reactions can range from mild irritation to severe anaphylaxis, making a thorough inquiry essential. Always avoid using any products that may trigger an allergic reaction, and have an emergency plan in place for severe reactions. A patch test is highly recommended for clients with known sensitivities. Certain medications can make the skin more sensitive or prone to bruising. Clients taking blood-thinning medications, for example, may be at a higher risk of bruising during ultrasonic fat cavitation, as these medications inhibit normal clotting. Other contraindications: skin sensitivity and type. Some individuals have naturally sensitive skin that may react adversely to ultrasonic fat cavitation, experiencing heightened redness or irritation. This sensitivity can be genetic or acquired due to environmental factors. Conduct a thorough skin assessment during the consultation to identify any pre-existing sensitivities. This includes observing the skin's reaction to touch and asking about past experiences with cosmetic treatments. Different skin types, such as oily, dry, or combination skin, may react differently to ultrasonic fat cavitation. For instance, dry skin might require more coupling gel, while oily skin might be less prone to bruising. Chapter 2: Conclusion. Practitioner responsibility. In summary, recognizing skin diseases and disorders, as well as understanding contraindications, is absolutely essential for ensuring the safety and effectiveness of ultrasonic fat cavitation treatments. This knowledge forms the bedrock of responsible practice. Always prioritize the client's health and well-being by conducting thorough consultations, being aware of potential skin issues, and providing appropriate guidance and referrals when necessary. This proactive approach minimizes risks and builds trust. By diligently adhering to these principles, you will establish trust and credibility as a skilled and responsible practitioner in the field of ultrasonic fat cavitation. Your commitment to safety directly reflects on your professional reputation and client satisfaction. Operator safety, protective gear, and body mechanics. Health and safety are paramount when performing ultrasonic fat cavitation treatments, encompassing both operator and client well-being. This chapter emphasizes creating a secure environment for all parties involved. To ensure operator safety, it is imperative to wear appropriate protective gear, including disposable gloves, a lab coat or apron, and safety goggles. These items protect against exposure to body fluids, chemicals, and accidental splashes. Maintaining good posture and using proper body mechanics are essential aspects of operator safety. Since treatments can take time, operators should take short breaks to rest and stretch, preventing musculoskeletal issues like back strain or carpal tunnel syndrome. Operator safety, training, and emergency preparedness. Before performing ultrasonic fat cavitation treatments, operators must undergo thorough training and obtain the necessary certification. This training covers technical aspects, proper equipment use, client safety, and hygiene practices, ensuring competence. Certification ensures operators possess the knowledge and skills to perform treatments safely and effectively, reducing the risk of errors and complications. Many jurisdictions require specific certifications for aesthetic procedures. Operators must also be well prepared to handle emergencies that may arise during or after a treatment session. This includes being trained in basic first aid and knowing how to respond to adverse reactions, such as allergic responses or injuries. An emergency plan with contact information for medical professionals is crucial. Client safety, skin assessment, and contraindications. Before initiating an ultrasonic fat cavitation treatment, a thorough skin assessment of the client is crucial. This helps identify any skin conditions, allergies, or contraindications that could affect the treatment's safety and effectiveness. Common skin conditions to watch for include eczema, psoriasis, open wounds, or infections in the treatment area. A detailed visual inspection and client interview are essential components of this assessment. Understanding contraindications is vital to ensure client safety. Examples include pregnancy, breastfeeding, a history of cancer, severe obesity, liver or kidney disease, and uncontrolled diabetes. Educate clients about these during consultation to prevent potential harm. Client safety, patch testing, and informed consent. For clients with sensitive skin or a history of allergies, patch testing is highly recommended. A small amount of the ultrasonic gel used during the treatment can be applied to an inconspicuous area of the skin, such as behind the ear or on the inner arm, to check for adverse reactions. This precautionary step helps identify any potential allergic responses before proceeding with the full treatment, preventing widespread irritation or discomfort. The patch test should be observed for at least 24 to 48 hours. Before starting any treatment, operators must obtain informed consent from the client. This process involves explaining the procedure in detail, including its benefits, potential risks, and expected outcomes, using clear and simple language. Client safety, communication, and monitoring. During the treatment, maintaining open and clear communication with the client is paramount. Ensure they are comfortable throughout the session by regularly checking in on their comfort level and adjusting equipment or settings as needed. Encourage clients to communicate any discomfort, pain, or unusual sensations promptly. This proactive approach allows the practitioner to address concerns immediately and prevent escalation. Operators should closely monitor clients throughout the treatment session, observing their skin for any adverse reactions such as redness, swelling, or blistering. If any concerning symptoms arise, the treatment should be stopped immediately and appropriate action taken, such as providing first aid or seeking medical attention. Client safety, post-treatment, and emergency response. After completing the ultrasonic fat cavitation treatment, conduct a post-treatment assessment to ensure the client's well-being. Check for any immediate side effects, assess the treated area for changes, and offer clear aftercare instructions. Provide clients with guidelines on how to care for their skin and what to expect in the hours and days following the procedure. This includes advice on hydration, diet, and activity levels. In rare cases, emergencies like allergic reactions, burns, or injuries can occur. Administer first aid as needed, seek medical attention for severe issues, and document all incidents thoroughly for liability purposes. Having a clear emergency response protocol is non-negotiable. Hygiene methods, sanitation practices. Hygiene is of paramount importance in any beauty or cosmetic procedure, and ultrasonic fat cavitation is no exception. Maintaining a clean and hygienic environment is essential for the safety and well-being of both the client and the practitioner, as well as for the efficacy of the treatment. Sanitation practices encompass a range of techniques and protocols aimed at preventing the spread of pathogens, infections, and contaminants. These practices are critical to ensure client safety and maintain the integrity of the treatment, preventing cross-contamination. Understanding the difference between disinfection and sterilization is fundamental to implementing proper sanitation practices. Disinfection reduces microorganisms on non-porous surfaces, while sterilization completely eliminates all microbial life, including bacteria, viruses, and spores. Cleaning and disinfecting surfaces. To maintain a clean workspace, a multi-step process for cleaning and disinfecting surfaces must be followed. This begins with pre-cleaning, which involves removing any visible debris or residues using disposable wipes or a damp cloth. Next, use an appropriate cleaning solution to thoroughly clean all surfaces, paying special attention to areas that may have come into contact with bodily fluids or products. Ensure all cleaning agents are compatible with the materials being cleaned. Finally, apply a suitable disinfectant to the cleaned surfaces according to the manufacturer's instructions, allowing sufficient contact time for effectiveness. Regular maintenance with a routine cleaning and disinfection schedule is crucial, especially for frequently touched surfaces like doorknobs and light switches. Sterilization of equipment. Equipment that directly contacts the client's skin or bodily fluids must be sterilized to prevent cross-contamination, as disinfection alone is insufficient for these critical items. This is a non-negotiable safety standard. Autoclaving is the most effective method for sterilization, commonly used for metal instruments. It involves subjecting equipment to high-pressure steam at specific temperatures and durations to kill all microorganisms, including resistant spores. For non-metallic or sensitive equipment that cannot withstand autoclaving, chemical sterilization using approved liquid disinfectants or sterilizing solutions is an option. Always follow manufacturer's instructions closely. Whenever possible, using single-use, disposable items that are discarded after each client eliminates the need for sterilization and ensures the highest level of hygiene. Storage of sterile equipment and personal hygiene. Proper storage of sterile equipment is as important as the sterilization process itself to maintain its integrity. Sterilized equipment must be stored in a clean, dry, and dust-free environment, protected by sterile wraps or containers until use. Regularly check the expiration dates of sterilized items, such as disposable probes or covers, and discard any expired materials immediately. This prevents the use of potentially contaminated or compromised equipment. Vessel hygiene is equally vital for the practitioner in maintaining a sanitary workspace and professional image. Clients expect high levels of professionalism and cleanliness, and your personal hygiene significantly contributes to their overall experience and trust. Hand hygiene and attire. Hand hygiene is the cornerstone of personal hygiene in the context of ultrasonic fat cavitation, preventing the transmission of harmful microorganisms to clients. Proper hand washing with soap and warm water for at least 20 seconds is required before and after each client interaction. If soap and water are not readily available, an alcohol-based hand sanitizer with at least 60% alcohol should be used, ensuring complete coverage and rubbing until dry. This provides an effective alternative for quick sanitization. Nail and jewelry maintenance is also crucial. Keep nails short and clean, as long nails can harbor dirt and bacteria. Avoid excessive jewelry on hands and wrists, as these can also be sources of contamination. Your choice of attire and uniform impacts both personal hygiene and client impression. Wear clean, appropriate attire that covers skin and minimizes contamination risk, changing into a fresh uniform for each client. Respiratory hygiene and personal care. In the wake of global health concerns, observing proper respiratory hygiene is crucial to prevent the spread of respiratory illnesses. This includes covering your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of used tissues immediately in a closed waste bin. If you or the client are ill or experiencing symptoms of illness, it is advisable to reschedule the appointment to avoid potential transmission, protecting everyone's health. Maintaining good personal care is essential, not only for your hygiene, but also for creating a positive client experience. Ensure your skin is clean and free of open wounds. Avoid strong fragrances that may trigger allergies, and maintain a well-groomed appearance to convey professionalism and instill confidence. Equipment setup, workspace, and power. Proper equipment setup and maintenance are crucial for performing ultrasonic fat cavitation treatments effectively and safely. This chapter details how to correctly set up and maintain equipment for consistent performance and longevity. Before setting up your machine, ensure your workspace is clean, well organized, and free of clutter. Create a dedicated treatment area that is comfortable for both you and your client, ensuring easy access to electrical outlets and adequate room ventilation. Your ultrasonic fat cavitation machine requires a stable power supply to function correctly. Ensure the power source is grounded and free from surges or fluctuations. Using a surge protector or uninterruptible power supply, UPS, can protect your equipment from electrical issues and extend its lifespan. Equipment setup, assembly and calibration. Follow the manufacturer's instructions meticulously for assembling the machine components. This typically involves attaching the handheld applicator to the main machine unit, ensuring all connections are secure and that there are no loose or damaged parts. Proper assembly is critical for both the safety of the operator and the client, as well as for the optimal performance of the device. Any loose connections could lead to inconsistent treatment or equipment malfunction. Each machine may have slightly different settings and calibration procedures, so consult the user manual provided by the manufacturer. Typically, you will need to calibrate the machine's intensity levels, timer settings, and frequency to ensure it operates within specified parameters and delivers the desired treatment effect. Equipment setup, gel application, and client positioning. Apply a suitable ultrasound gel or coupling agent generously to the treatment area. This gel is essential as it facilitates the transmission of ultrasound waves into the skin, ensuring proper contact between the applicator and the client's skin. Use enough gel to create a smooth and even layer, but avoid excessive amounts that could become messy or interfere with the treatment. The gel also helps the applicator glide smoothly over the skin, enhancing client comfort. Guide your client into a comfortable position on the treatment table, ensuring they are adequately covered and that their skin is accessible for the procedure. clear communication with your client about their comfort and positioning is essential throughout the process. Equipment maintenance, cleaning and inspections. Maintaining a clean machine is essential for both hygiene and optimal performance. After each treatment session, wipe down the machine's exterior with a clean, damp cloth, paying special attention to areas that may have come into contact with gel or bodily fluids. Avoid using abrasive or harsh cleaning agents that can damage the machine's surface or internal components. For the handheld applicator, disconnect it from the machine after each use and remove any excess gel with a clean cloth. Use a mild, non-alcoholic disinfectant or sanitizing solution recommended by the manufacturer to clean the applicator thoroughly. Then, rinse with clean water and allow it to air dry completely before reattaching. Regularly inspect your machine for signs of wear, damage, or loose components, including cables and connectors. Equipment maintenance, calibration and logs. To ensure accurate and consistent results, periodically calibrate your machine as recommended by the manufacturer. Calibration may involve adjusting the power output, frequency, or other settings to ensure the machine operates within specified parameters and delivers the desired treatment effect. Maintain a detailed maintenance log for your ultrasonic fat cavitation machine. Document each cleaning session, calibration, and any repairs or servicing performed. This log serves as a valuable record of the machine's history and can help identify any recurring issues or patterns. Consider scheduling annual servicing by a qualified technician or service center, even if the machine appears to be functioning correctly. Annual servicing can identify and address potential problems before they become major issues, significantly prolonging the lifespan of your equipment and ensuring continued safe operation. Equipment maintenance, storage and troubleshooting. Properly store your machine when it is not in use to protect it from damage and extend its lifespan. Keep it in a cool, dry place away from direct sunlight and extreme temperatures, which can degrade components. If you need to transport your equipment, always use a protective case or packaging recommended by the manufacturer. This prevents damage during transit, ensuring the machine remains in optimal condition for future use. Familiarize yourself with common troubleshooting techniques provided in the user manual. Troubleshooting can help you identify and resolve minor issues without the need for professional repairs, saving time and cost. Always contact the manufacturer or a qualified technician for more complex problems. Conclusion: equipment setup and maintenance. Proper equipment setup and maintenance are vital for the successful and safe operation of an ultrasonic fat cavitation machine. Adhering to these guidelines ensures optimal function and consistent results for clients. Regular cleaning, routine inspections, and adherence to manufacturer recommendations are essential practices for any responsible practitioner. These steps not only extend the lifespan of your valuable equipment, but also uphold safety standards. Remember that well-maintained equipment not only enhances the client experience by providing reliable and effective treatments, but also significantly contributes to your professional reputation and the overall success and sustainability of your practice.